Hello, my name is Justin Graham, and I'm a program manager with Rise Vermont in Chittenden County. Thank you for joining us for Rise and Walk Virtual Edition. Through Rise and Walk, Rise Vermont is encouraging Vermonters to walk 30 minutes, 3 days a week, and hosting health talks with local professionals. With me today is Dr. Cedric Pecor. Cedric is owner and dentist at Milton Family Dentistry in Milton, Vermont. Cedric will be talking with us today about dental hygiene. Cedric?
Hi, Justin. Thanks for having me. Justin asked me to give you guys a quick talk about good dental hygiene habits to get into. I think really the most important thing for everyone to do is to just get into a good routine as far as dental hygiene goes, which basically means making sure that you're brushing twice a day and flossing once. As far as when you brush, morning, you really can brush anytime in the morning, whether it's when your feet first hit the floor when you get out of bed, or if it's after that first cup of coffee or breakfast. Just making sure you brush them in the morning is important. And then at nighttime, ideally, you would make sure that you're brushing your teeth right before you go to bed. That way, there's no food, plaque, anything sitting on your teeth overnight. And right before bed is a great time to get in that floss as well. So, flossing one time a day is really enough for flossing. You can do it more if you want, but you really should try to do it at least once. Nighttime is best, but again, I'd rather you get in there and floss once a day than not do it at all.
And Cedric, is there a recommendation for manual versus electric toothbrushes that are pretty popular now?
Yeah. Both manual and electric toothbrushes are great. The electric toothbrushes do have some benefits. As you get older, arthritis can develop. That can kind of hamper some of our patients' dexterity. So the electric toothbrushes tend to have a bigger grip that they can hold on to. They require less dexterity to operate. So they can be a good tool for patients that have less dexterity. Another good part about an electric toothbrush is it does help prevent overbrushing or aggressive brushing. A lot of people think that the harder they brush, the cleaner their teeth are going to be. And oftentimes, their teeth are going to be really clean, but brushing hard can lead to some wear, erosion, and problems in the future. So an electric toothbrush a lot of them have a sensor that can prevent that overbrushing. And you can really let that toothbrush do the work for you so you're not having to brush.
Hmm. And how often should people see their dentist, Cedric? I think the standard since I've been a young person has been twice a year. Is that
Yeah,
still the kind of main goal?
yeah, I would say twice a year is good. It's important to go have your dentist take a look, make sure there's no cavities. It's also really important to have the hygienist get in there and clean your teeth. Basically, the really important thing that the hygienists are doing for you guys is over time, plaque that's on your teeth can become calcified, and that turns into calculus. And even if you're a really great brusher and flosser, it's going to be really hard to remove calculus on your own. So that's why you go to rely on the hygienists who are going to do a good job removing that calculus to help create a better oral environment for yourself.
And what about fluoride use? What's the recommendation? Is that an everyday thing with flossing as well? Is that once a week? What do you recommend for people regarding fluoride?
Yep. Fluoride can be a really good tool to use for people. If you're living in an area where you have well water and you don't have fluoride in your drinking water, or say you're someone who has a higher decay rate, so every time you go to the dentist, you have one or two cavities, it might be a good idea to incorporate a fluoride rinse into your routine. You can get fluoride over the counter, Act as one brand, but there's many types of fluoride, many brands. As long as you get a mouth rinse which contains fluoride, use it at nighttime. Again, brush, floss, and last thing you would do is choose that fluoride rinse, swish for a minute, spit it out. Don't rinse afterwards because you want that fluoride to sit on your teeth overnight and really do the work for you.
And one of the things I feel like when I hear, or what I hear from when I go to the dentist is to maybe lay off the sugar sweetened beverages or the sweets to eat Is there any additional recommendations regarding sweetened beverages or food that we can be practicing to make sure that we're not eroding our teeth as quickly or something like that?
Yeah, I certainly wouldn't give up a sugary beverage or tell people you can't have candy. I don't think that's really realistic. But what I would say is you want to make sure that you aren't sipping on a sugary beverage or having candy kind of frequently throughout the day. Basically, what happens is you have bacteria in your mouth, which when you have those sugary beverages, the the bacteria convert that sugar into an acid, and that acid is what can lead to cavities. So if you're constantly having a sugary beverage or candy, your mouth is always acidic, which leads to more cavities. If you have a sugary beverage once a day, you brush or swish out with water afterwards, not a big deal. The acid content is gone from your mouth within 20-25 minutes because of the saliva. Uh, so certainly don't do it throughout the day. One and done is okay to do.
All right. Well, thank you so much for your tips, Cedric. For additional information on dental hygiene discussed today, go to Rise and Walk at risevt.org. And remember to rise and walk for at least 30 minutes today. Thank you.